7 mantras for a successful career of any system of medicine. Number 1, practice only homeopathy or whatever system you are specialized in. Practice that. You are Ayurveda, you are what you call naturopathy, do it. I'm not saying no. But don't mix all the things together. Don't criticize other doctors. This is a very bad habit in us. Allopathy is very bad. It creates a lot of problems. Don't say that. You say what is your system. You say how you can help the patient. You just guide people how to be healthy and help them with your medicines. But make it a practice never to criticize other doctors. Even same homeopathy doctors, your professors, your friends, your colleagues, never do that. Don't criticize, as I told you, other systems of medicine. Ayurveda is like that, yoga is like that, homeopathy is like that. Don't say that. You talk of what you are. Don't promise to cure all. This is a very big wrong thing we have seen in the, at least the homeopathy doctors. Whatever it is, cancer, I'll cure. Don't commit. Don't make such tall Himalayan promises. Because today's patients are more educated, more learned, well informed, much more than the doctors. Because my practice being a super specialty, people go to all systems of medicine, then they go to some homeopathy doctors. If they are not able to get relief, then somebody refers to me, they come to me. They come with this big file. And before coming here, they will go to Baba, Google, study all the symptoms, all the possibilities, and they come and discuss with us. So never ever misguide a patient, wrong inform people. You can state as, sir, I'm not aware of these things, because medicine is a very vast field. Many things are there in the world which I do not know. I'm trying to upgrade myself. And patient will be happy to listen to this. A sensible patient will say, doctor is sincere. Doctor is straightforward. So never promise to cure all diseases, because nobody can cure all diseases, including God. Every disease, every system, every treatment, every physician has their own limitations. And in special homeopathy, the treatment depends on how the patient responds, and patient's response will be depending on so many factors. Your medicine may be correct. You may be handling them with all your knowledge and all that. But the factors the patient is going through maybe it's different, and each factor affects. Advise investigations, whatever necessary only. Some people have a habit. The moment you go to a doctor, पूरा 15,000 का test लिख दो, because you get 30% cut. Never ever encourage this type of practice. See, in the beginning, it may give you some funds and all that, but that's not going to stay long. Advise only those tests which are needed, which you feel, yes, this is needed for me, for my this case. General checkup. One of the medicines medical world is doing is annual checkup, general checkup. Please don't advise that. That is the best way of trapping the patients commercially. I am a person who always advises what is needed. Many times I don't advise them any tests unless I feel yes, it is necessary. MRI. Recently a patient came with a neurological problem in her neck. So I'm having cervical spine, all the, I said, fine. We treated for 4 months, we got relief, but it was persisting. Then we advised for an MRI. And there we got a place where it was being pressed by a protrusion, by a small tumor coming out. That was needed. So prescribe, write, advise, investigations only when they are necessary, not as a routine practice. Be empathetic to the patients. This is a most important part of homeopathy, and AYUSH people also can. See what happens. The moment a patient comes, yes, what's your problem? I'm having this dental problem. Okay, show me, open your mouth, take there. Okay, you need filling of the teeth. Take this, take appointment, come back and get up. That's okay. That's a mechanical way of treating. But in other cases, in other system, patient comes with a fever. Patients come with the chronic elements like arthritis. Let us say irritable bowel syndrome, or say migraine. What is it? You are having migraine. Okay, when does it come? Oh, okay. Take migranil or some antibiotic. That's not going to help them. Make them sit. Try to understand why they are getting migraine, why they are getting IBS. What is the problem? Irritable bowel syndrome. Everybody knows that's okay, fine. But there is some reason behind that. You make them sit and understand. Try to get their mental state. Then they'll come out. Unless you solve that problem, this IBS will not go. Unless you solve that problem, his migraine will not go. There is always a problem with the husband. Keep on shouting at her. And how long a lady can tolerate? And she doesn't come. She says, I'm having headache, right side, comes in the morning, evening, before menses, all that. Any number of medicines you prescribe, it may give a temporary relief, but not permanent. Many of the migraine cases, the moment they come, we say that minimum, madam, you need half an hour. You should be able to spare half an hour time with me. Then we probe, we go. Many things come out which are not important for her, but in the case taking, more than migraine, those things are important. Sir, my daughter is 35 years, sir. She is not getting married, sir. There's a big headache, sir. Unless you solve that problem, not, I mean to say, that problem, the migraine will not go. Sir, my husband is a drunkard, sir. He does every time, and I'm fed up, sir. Fed up. So many times I told there are so many problems. There is so that empathetic approach must be there. You must put yourself into their position, but not emotionally involved with them. Then only you'll be able to help. And that is one of the plus points of the AYUSH doctors. They give time to the patients. Many of you see, 100, I'm seeing 40 patients per day. It's not possible. Maybe morning 3 hours, evening 3. No. What you charge is left to you, but you must give a patient hearing to the patient. Like professionals, give service and charge, but money should not be the sole aim. You need money. You are a professional. Even this course, what they are doing is a profession. Do it. Charge. But only that should not be the aim. Success is science, not in politics, of course. If you are successful, you are scientific. And with all the principles what I have been talking, you must do that. Educate the public about the system in which you have specialized. Unless you educate them, they will not understand. They are not trained doctors like you. Because today, doctor means only MBBS, only MD, only big hospitals. That has become a norm. Homeopathy, what homeopathy, Ayurveda, sir, ये नो sir, गोता sir, we don't know sir, पता नहीं क्या है, समझ में नहीं आता. चलो ठीक है जाएंगे. Many people come to us out of no choice because they are not getting relief. They come. They don't come because of out of the choice to take homeopathic medicine. Now, see, I have been in Bangalore for the last 35 years, and I made a slogan: सारे पतियों के बाद तिरुपति, उसके बाद homeopathy, उसके बाद Patelpati. Which means after all the treatments are over, you go to Tirupati. Even there you don't get relief, you go to homeopathy, and there also you don't get relief, then you come to me. This is what it is. So you must educate them. Let there be first choice on AYUSH system of medicine. If you don't get relief, then you can think of allopathy. If this much you can convince the people, there is a lot of opportunities for AYUSH systems of medicine. Education will bring a lot of change. When I say education, not qualification. A person without any degrees will be able to handle big issues rather than having qualified degrees. Best example is your Prime Minister. Officially, he doesn't have any degree. Maybe some Hindi course he might have done and passed and all that. He doesn't have Harvard University degrees. And to be precise, when Harvard people were asked what you will teach Modi, they said, Modi can teach each department something new which we don't know. So education is not qualification, not a degree. Change the mindset of the public. For general public, doctor means only MBBS. That concept is given by Britishers, and we are following this. This point you must go into it. Just think, before Britishers came, were Indians not healthy? Was there no medicine? No surgery. I can go on long and long on Ayurvedic surgeons did so many operations. Ayurvedic medicines, Ayurvedic way of living, they have given so many solutions, which all Indians were following. But the Britishers have changed your mindset. Education means only English. Medicine means only MBBS. This you need to change this concept. Maintain records and exhibit or show to the general public what your specialization can do. AYUSH physicians helping people and making their career. So friends, take what you feel useful and you can leave the remaining. It is called as Hansakshir Nyaya. Hansakshir, Hans, you know, it when you put milk and water together, it knows what to take. Only it takes milk and not the water. So like that, we should be we should do it in life. Many people, we meet many people, we see many things. So let us take what's useful and good for us. With this, thank you very much.